Hello and good evening. It's Saturday evening and I'm just catching up with you to let you know how the bone marrow biopsy went on Thursday. I was a little bit apprehensive about it, but as usual at the Vic they were very patient and spent quite a lot of time explaining the procedure. I was taken into a little room where there were some comfy seats and not quite sure what her title was actually, but it's the medical professional who does the bone marrow biopsies. Very nice lady who explained quite thoroughly the procedure and why they were doing the procedure. And I can remember thinking at one point, if I get up and run away like a 2-year-old, does that look a bit silly? Anyway, I resisted the temptation, but it did, whilst it was supposed to be reassuring, I think it did sort of make me a bit apprehensive, but knowledge is power. So obviously the bone marrow biopsy is to see if the lymphoma cells are within my bone marrow, which means that it's kind of sort of spread systematically or not. So the not is the thing that we're hoping for, and also the PET scan that I haven't got an appointment for yet will sort of more examine in a 3-dimensional image various organs and things to see if there's any signs of any lymph node swelling or enlargement, which would suggest that things have spread to different areas or not. And again, the not is what we're hoping for, and in that scenario I would be then having radiotherapy, which we'll cross that bridge when we come to it, but which I have learned is something that is on a daily basis for however many sessions, which I kind of wasn't aware of at the time when they discussed that at the appointment. But like I say, there's like lots of questions keep rising themselves up as we go along this journey. So this is what these videos are all about really, and hopefully, you know, this would help other people who are going through a similar process. And everybody's processes are different and everybody's experiences are different, but as a general thing, these are my experiences and it might help. So the bone marrow biopsy, we talked in this little side room and then went straight through into the procedure room, where a nurse came in, and again, everybody's different in how they cope with having things done like that. And my coping mechanism is I like to talk, and I talk a lot, and I like people to ask me questions and talk back to me, and that takes my mind off what's happening, which is probably why I'm not great at the dentist. So I did explain that, you know, I do like to talk, so you know, chat away, and I do like to know what's happening, what they're doing, and what's happening next. And if I don't want to know, then I can say so. But I do like to know what's happening. So in a synopsis of the whole procedure, it was quite bearable. It certainly wasn't the worst procedure that I've had done, and I think given a choice between a bone marrow biopsy or a colonoscopy or a gastroscopy, I would probably pick the bone marrow biopsy. It's uncomfortable and it is painful, but it's not unbearable. So the administration of the local anaesthetic that is quite painful in itself. It's like a dull pain, I would describe it. Obviously the first injection of that is like the scratch sting that you get whenever you have an injection or anything with a needle. And there's a lot of sort of prodding about, which that creates sort of like a pain anyway. It's like somebody pressing on a bruise is the way that I could describe that. So, and sometimes there are periods when you can't actually feel anything very much, and sometimes when it's like, ooh, but you know, like I said at the beginning of it, it's not going to last all day, so grin and bear it. When she said, oh, you'll feel a pinch, which is when the sort of the biopsy needle went into the bone, I didn't actually feel a thing at that point, but I felt it coming out, and that was quite uncomfortable. And then it ached a bit afterwards as I was sort of, well, they say to get off the table slowly, blah blah blah, and put your legs down slowly in case one of you, like, it was on my right side, so like in case my right leg had gone all dead. Anyway, that was fine, and I walked out okay, and then I went to see the Macmillan people, and I'd sat down on a chair for a little while. When I got up, it was like, ah. So I did actually get some paracetamol while I was in the hospital and take them, even though the local anaesthetic had worn off. And it is quite painful afterwards. It's like I've never been kicked by a horse, but it's like you've been kicked by a horse, or you've had a hard blow to the top of your bum. And excuse, you know, my flesh, but I will show you where it is. So if I can get my bits and bobs, you can just see a slight bruising there. You have to keep the dressing on for 24 hours, not get it wet, so no shower or bath or anything. And when you sort of lean back on something, and so it touches something, it hurts. And the first night, it woke me up a few times if I moved around in bed, but it's just sore. It's nothing hideous. It's nothing, you know, it's nothing that anybody couldn't bear or tolerate. Like I say, we're all a bit different, but sometimes I'm quite a softie, so it's not anything that's like really unbearable. So I imagine, like everything, those results will take about 2 weeks to come through. So that's just wait and see. When we were talking, when she was doing the procedure, she actually told me that a doctor that works on that unit at Blackpool Vic has actually had that, who does the procedures and, you know, things like that. He actually had a bone marrow biopsy done himself, and I went, oh gosh, you know, that's something. And she said, yeah, just to see what it felt like. I was like, really? That is dedication, isn't it? So a doctor on that unit has gone through that procedure so that he can have that empathy with his patients, I guess, which is going above and beyond, isn't it? And that kind of shows the level of dedication of some of the staff on that unit. It's incredible. So that's my bone marrow biopsy. Like I say, wait for the results of that. The next thing is the PET scan, and then a meeting with the consultant again. I'm going to try and fiddle with these videos and make them a bit more entertaining. Not that this is a very entertaining subject, but I am going to try and sort of have a fiddle. If it just comes through as a plain video like the ones have come through before, then I clearly haven't managed it. But my son is going to do me a little bit of intro music at some point, and I've got this sort of video editor So if this comes through with a bit more enhancement, then I've managed it. If it doesn't, then I haven't. I might go back to the drawing board and try again. So that's the update for now. I am still sticking to a healthier diet and having lots of green vegetables, lots of asparagus and broccoli and sugar snap peas and salads and leaves and things like that, and fish. So I have been sticking to that and reducing my intake of sweeties. So I've been quite good so far. And I'm feeling okay. I'm feeling quite tired towards the end of the day, but I'm feeling okay. I'm still sort of doing all the usual things at the moment and managing to get through. People have been incredibly supportive, and you know, a lot of people have offered help, and I am accepting that now. So yeah, it's okay at the moment. Yeah. So I will see you again the next time there's something to report.